What's the essential problem? You know, I mean, I love being a clinical psychologist when you could still do that and tell the truth, which wasn't that long ago. But there were no intermediaries.
So I'll tell you exactly the moment it started changing, because I learned this in my health policy law class from Professor Hank Greeley in Health Law and Policy at Stanford. Lyndon Johnson Medicare Act of 1965, the preamble paragraph says, nothing in this Medicare Act should be construed to interfere with the practice of medicine. And I was sitting there as a young doctor, law student, and I raised my hand and I said, every single thing Medicare has done has interfered with the practice of medicine, 100%.
That's why they put that preamble there to begin with.
Nothing in this everything came from interfering with the doctor-patient relationship. Everything. There's intermediaries. There is no more doctor-patient relationship for most patients. It's in a big insurance company right in the middle, or a big hospital corporation right in the middle.
Or in Canada, you just can't get a physician. 1 in 5 now with no physician in Canada.
What's happening, in your country, we could talk about for days.
Yes, it's a series of catastrophic miracles.
It couldn't be worse.
Yeah. Well, and we've substituted dying for paying. Yeah. Right, which is not a great substitution.
We write a lot about the MAID. It's horrific.
Yeah.
It's horrific.
Yeah. Well, it's going to get worse before it gets better.
Yeah.
So
I think my dad was a brilliant man. He was a Holocaust survivor, comes to America, does extremely well, smart, amazing guy, wanted to be a doctor. I was a doctor. We were all doctors. But we also saw patients in our house. That was something my dad did. He would do hospitals and nursing homes all day, and then we'd have patient hours at night. So I saw the care between a doctor and a patient. So I know what it can be. I know what it can be. And I'm holding on to that and saying, I don't understand how in modern times, why can't we also have that?
Right. Well, yeah, right. That's what you want.
But you have so many...
Because it's a relationship, right? I mean, you should have a relationship with your patients. Right.
Basically, a doctor, like another educated consultant, when you pay a lawyer, I'm sure you have a lot of lawyers, they're working for you. They're not working for the government. They're not working for a big corporation. They're working for you to serve your interests. If they're not good enough, you move on, you get a different lawyer, right? Why do we not have that in medicine? Because the world has told us medicine is too complicated. Medicine needs an intermediary. The patient can't understand medicine. Even Trump during COVID couldn't understand. He sort of left it to the experts.
Yeah.
I am done with that. A person can make their own medical decisions with the advice of a smart consultant, exactly like they do when they buy a house, when they fill out their tax forms, when they see a lawyer or an accountant. There's nothing magical and so black box that a patient can't understand. I'm an emergency physician. I could explain any disease to a person, either the 2 or 3 minute version or the 15-minute version.
Right.
100% of diseases can be explained in 3 minutes or 15 minutes.
Well, and if the patient isn't in charge of their own decisions, they're not going to comply with the recommendations of the physicians anyways. I mean, compliance is a big problem, and you don't get compliance from patients unless they trust you.
Unless trust is everything.
Yeah, and that's a hard thing to build, especially when people are in crisis.